Hey guys, do you know what an anxiety is? Have you ever had a feeling of anxious about moving to a new place, starting a new job, going to a new school, or even taking a test? This type of anxiety is unpleasant, but it is normal and may motivate you to work harder and do a better job. Ordinary anxiety is a feeling that comes and goes, but does not interfere with your everyday life. However, in the case of an anxiety disorder, feeling of fear may be with you all the time. It is intense, excessive, and persistent worry and fear about everyday situation. This type of anxiety can cause you to stop doing things you enjoy. In extreme cases, you can even have fear of leaving your home. If left untreated, the anxiety will keep getting worse. Anxiety disorder are a common form of emotional disorder and can affect anyone at any age. One common example of anxiety disorder is panic disorder, which is an experienced recurring panic attack at an unexpected time. A person with panic disorder may live in fear of the next panic attack. Another common anxiety disorder is phobia. Phobia is an excessive fear of specific object, situation, or activity. It can also provoke panic attack in some people. Social anxiety disorder is also a type of an anxiety disorder where it is an extreme fear of being judged by others in social situations due to feeling of embarrassment, self-consciousness, and concern about being viewed negatively by others.
Anxiety symptoms vary person to persons. In general, the body reacts in a very specific way to anxiety. When you feel anxious, your body goes on high alert, looking for possible dangers and activating your fight and flight responses. As a result, some common symptoms of anxiety include the increase of heart rates, rapid breathing, nervousness, restlessness or being tense, trembling or muscle twitching, insomnia, the increase of heavy sweating, and also trouble concentrating. According to the National Institute of Mental Health, researchers believe that a combination of genetic and environmental factors like diet and stress, as well as brain chemistry, may play a role. A study found that RB-FOXP1 genes may be involved in the development of anxiety-related conditions, such as generalized anxiety disorder. Besides, certain parts of the brains, such as amygdala and hippocampus, are also being studied. Amygdala is a small structure deep inside your brain that processes threats. It alerts the rest of your brain when there are the signs of dangers. While hippocampus is a region of your brain that's involved in storing memories of threatening events. Both of them may increase the risk of developing an anxiety disorder.
Hi guys, next I would like to talk about are there any tests that diagnose anxiety and what are the treatment for anxiety? Actually, a single test cannot diagnose anxiety. Instead, an anxiety diagnosis requires a lengthy process of physical examination, mental health evaluation, and psychological questionnaire. Some doctors may conduct a physical exam, including blood or urine tests, to rule out underlying medical condition that could contribute to symptoms you are experiencing. Several anxiety tests and scales are also used to help your doctor assess the level of anxiety you are experiencing. Anxiety is not a simple diagnosis. It's not caused by a germ that can be detected in your blood test. It takes many forms and can also accompany another medical condition. To diagnose anxiety, a complete physical examination is essential. This helps your doctor discover or rule out other illness that may be causing your symptom or that may be masked by your symptom. A complete personal history is also necessary for your doctor to make an accurate diagnosis. Do you know there is a lot of diagnostic tests are used nowadays, such as Zoom Self-Rating Anxiety Scale, Hamilton Anxiety Scale, back anxiety inventory, social phobia inventory, Penn State worry questionnaire, generalized anxiety disorder scale, and Yale-Brown obsessive compulsive scale. And what is important is each of these tests varies the method, questions, and range of the result. Next, what are treatment for anxiety? Once you have been diagnosed with anxiety, you can explore treatment option with your doctor. For some people, medical treatment is not necessary. Lifestyle change may be enough to cope with the symptom. In moderate or severe case, however, treatment can help you overcome the symptom and lead a more manageable day-to-day life. Treatment for anxiety falls into two categories: psychotherapy and medication. Meet with a therapist or psychologist can help you learn tools to use and strategies to cope with anxiety when it occurs. Medication typically used to treat anxiety include antidepressant and sedative. They work to balance brain chemistry, prevent episodes of anxiety, and ward off the most severe symptom of the disorder. That's all for us. This is all about anxiety that you have to know, and please spread the awareness about the mental health for the others.